are you doing? I hope your Saturday is coming along really nicely. And today I want to speak about something that all of us are always hearing about, right from nursery school, class 1, class 2. I don't know how many of you guys were in a high school where you're not allowed to carry food from home like in our high school, and what is offered is githeri, then rice and ugali. And those people who used to be diagnosed with a disease called ulcers will be given special meals. And somehow it was an escape goat for most students, because once you say, my doctor said I have ulcers, and then there you get a special meal, you're off the hook. So that's what I want to talk about, ulcers. But before I do that, guys, I want to encourage you with this song that I've been loving over time. And the song is sung by someone called Michael Vashon, and it says that everything is turning around for me. So I'm just going to sing a chorus of it, and then we go right away to talking about ulcers. So it starts by saying, sometimes discouraged, but not defeated, cast down by, not destroyed. With times I feel so alone, but I believe it's turning around for me, around for me, around for me, around for me. It's turning around for me. Yes, guys, but just remember, it might look like things are not making sense and they are not adding up. But at the end of it all, God is working it out in such a way that it's turning around for you. So, what is ulcers? Just from the name ulcer, you have a wound, you have a break in your skin, you have a break in covering of a part of your body organ. Now when we talk about ulcers, the one which people know, I'll give it the name peptic ulcers disease. So inside your organs, your gastrointestinal system organs, within the covering which you call the epithelium, you get an ulcer, you get like a wound. And just imagine in a real case situation, if I have a wound here at my skin, if anything is going to pass by the wound which is acidic or salty, it's going to feel really pain. When the wound bleeds, I'm going to feel pain. When the wound heals and then it comes back again, I'm going to feel pain. So it's the same way how ulcers does inside your intestinal systems, and that is why people present with pain. So it's basically a wound within your intestinal system organs, and in this case, peptic ulcer disease, either in the duodenum or in the stomach, which will be referred to as a gastric ulcer in the stomach, or a duodenal ulcer in the duodenum. So, how will an ulcer present? If you have a wound on the, like here, if I have a wound, the thing number one is that there will be pain. And so these people tend to have pain, but the location of the pain is different. So where do they experience the pain? They experience the pain in the places where the organs have been affected. So the pain will be around this region above the umbilicus, so what we call epigastric pain, and that is where they feel a lot of pain. And this pain at times might be so severe that it literally wakes them up at night because of the severity of the pain. And then another thing, depending on whether the ulcer is in the duodenum, is in the stomach region or in the duodenum region, what happens is that some might really be aggravated by eating. Like if you eat and you pass food and food passes through that ulcer, there is a lot of pain. And so in some specific types of ulcer, when you have an ulcer in your stomach, you don't want to eat, because anytime you eat, it's worsened. And so such people, they tend not to eat because they're afraid of eating, and they end up losing weight. On the other hand, if you have an ulcer in the duodenal region, you find that when you eat some food, it tends to mildly relieve the pain. And so such people really won't have an issue with eating. But then we have some specific kinds of food that may worsen that pain. People with ulcers will complain many a times, if I take an acidic food, if I take oranges or if I take citrus, it's really going to worsen the pain. And then we have specific drugs that can expose you to getting ulcers if you're going to use them for a very long time, or they can worsen the condition if you have, and we refer to them as non-steroidal anti-inflammatory drugs, NSAIDs. And a common example that is available in the market is diclofenac. So if you have been diagnosed with ulcer, or you have these recurrent pains on the epigastric region, as I have pointed to you, then maybe you want to inform your doctor, you want to inform your clinician, and you want to avoid drugs such as diclofenac or drugs in that class because they might worsen the pain. Nevertheless, we have some groups of drugs that have been modified in such a way that they will still handle the pain and prevent inflammation, but they've been modified in such a way that they have fewer effects on the ulcer. So if you inform your doctor, that is really important. A major common cause of ulcers in our setting is H. pylori, an organism. This is a bacteria which affects your body. Okay guys, you see, like though you can have typhoid, and then of course you have a bacteria that causes typhoid. So in the same way with the peptic ulcer disease, you can have a bacteria that exposes you to getting it, and it's called the H. pylori organism. So what it does is that within your intestinal systems, we have some protective factors. You find that they are lined with mucus and some chemicals called bicarbonate. So that really helps to protect your intestinal wall. But what happens when you have this H. pylori infection? What it does is that, number one, it tends to interfere with the mucosal layer, so you don't have that protection, and it exposes you to getting ulcers, and also it produces some chemicals that are toxic to your protective layer. That's it about H. pylori, and that's why some of you probably have done what we call the H. pylori kit, the H. pylori test. Now, another thing with peptic ulcer disease, that these people may have vomiting, and that might be there. So the basic things that define an ulcer: majorly an epigastric pain that may be worsened on specific foods, and then either relieved by eating or worsened by eating, depending on the location of the ulcer. So from today on, if you hear your friend talking about, oh, I have an ulcer, at least you have an idea, and I've told you about the things that might expose you to it. So it's also very important that you work on that. And then finally, a major test that can be done, they can do what you call an endoscopic test, whereby they put something through your mouth and they just want to visualize your esophagus, and then your stomach, and then your duodenum, or you can do the H. pylori test. If you have any of the above things that I've talked about, it is prudent that you go see a doctor. And if you have any question on the same topic, you're very welcome. And bye bye guys, continue subscribing. Thank you so much.